Some medical news now. With sickness spreading and the holidays just around the corner, it's time for your vaccine check. Experts say there is still time to protect yourself against this season's respiratory viruses. The CDC has lowered the age for pneumonia vaccines to 50. That's down from the previous recommendation of 65. RSV shots now recommended for pregnant women, high-risk adults over 60, and everybody over the age of 75. Doctors say it's also the perfect time to get your COVID and flu vaccines.
That's easy. It's not too late, and you can get them both at the same time, according to the CDC. So, it takes a couple of weeks for them to kick in. It's about 2 weeks and 2 days from Thanksgiving, very late day for Thanksgiving. So go ahead and get them.
So you should get them.
Dr. LaPook recommends wearing a mask when you're in crowded spaces with poor ventilation. A new study says people who switched from cigarettes to vaping improved their respiratory health. People who made that switch said they experienced less coughing and wheezing, but people who used both products saw their symptoms get worse. And vitamin D supplements can help lower blood pressure for certain people. A study shows that older people with obesity and people with low vitamin D levels saw the most benefit, but the study also says taking more than the recommended daily dose of vitamin D has no added benefits. Do you have a sweet tooth? Well, blame genetics if you do. A study by the University of Nottingham identified what's called the SI gene, which impacts our ability to digest sugars. People who had a defective gene didn't like sugary foods as much, while people who had a normal SI liked sweets more and tended to eat them more often. So yeah, just blame genetics.